Okay, today we are going to talk about diabetes and your ears. What's the connection? My name is Maria Roa. I am the fourth year doctoral extern at UNC Hearing and Communication Center. I'm studying to be an audiologist and will be graduating in just a few months. I'm joined today by Dr. Caitlyn Whitson, audiologist, also at UNC Hearing and Communication Center. And we're going to get started. Okay. So to give you all some background on our clinic today, if this is your first time joining us, we are a nonprofit faculty practice of doctors of audiology. We're a training clinic for doctoral students like myself. We work with all hearing aid models and manufacturers. We're an unbundled fee-for-service business model. We offer vestibular balance testing and tinnitus specialty testing. We've got two locations. Our main clinic is at 6015 Farrington Road in Chapel Hill, and our satellite is in Hillsborough at the Orange Sportsplex. If you want to make an appointment, you can call that number and just let the ladies at the front desk know which clinic you'd like to go to. If you're watching this, I encourage you to go to our Facebook page at facebook.com/UNCHCC and give us a like. You could also find a link to our YouTube page there. And if you're watching this on YouTube, congratulations, you found us. So please hit the subscribe and like button. This is our agenda for today. We are going to teach you hearing loss and diabetes. So we know that hearing loss prevalence increases as we age. This is called presbycusis. At our clinic, we often see presbycusis types of hearing loss because that's largely the population that we work with. Presbycusis is typically caused by the loss of stereocilia or hair cells of our inner ears. But what physiology causes that? Causes the hair cells to die? Well, there's not a single known cause for age-related hearing loss. There are a lot of contributing causes that we categorize as such. So some of those contributing factors include noise exposure over our lifetime. That can create some damage to those little hair cells. Genetics also plays a role to damage over time. With research, we've identified a specific gene in chromosome 10 in mice that actually causes earlier hearing loss onset. And that's being explored more as well. Being exposed to medications or other environmental toxins can also create damage to those hair cells. And other medical conditions like heart disease or high blood pressure, kidney disease, low thyroid function, and of course, our topic for today, diabetes. So what is diabetes mellitus? Essentially, it's a chronic health condition that affects how your body turns food into energy. When we eat, food is broken down into sugar or glucose, and it's released into the bloodstream. The pancreas releases insulin, and our fat cells take the glucose from the blood. If you take a look at the right side of the diagram, you could see that as a reaction to high blood glucose, blood sugar rises, pancreas releases insulin, and fat cells take in glucose from the blood, thus bringing our body back to normal blood glucose levels. While in diabetes, or when diabetes occurs, the body stops producing insulin, or it can't make use of the insulin that's already made. The resulting buildup of sugar in the blood can lead to heart disease, vision loss, kidney disease, and or hearing loss, which we'll talk about today. we're going to go over the 4 classifications of diabetes. So diabetes type 1 makes up a small percentage of our population that encompasses 1.6 million Americans, usually children and young adults. Although with our increasing lifespan, we're starting to see it last into older adulthood. Diabetes type 1 is thought to be an autoimmune reaction that stops the body from making insulin. These individuals have to take insulin every single day to survive. And at this point, there's no known prevention. For diabetes type 2 makes up the vast majority of people with diabetes. That's about 34 million, or about 1 in 10. It's a lot of people. In type 2 diabetes, the body stops making insulin or can't use it properly. This is typically diagnosed in adults, but is becoming increasingly common to see in children and young adults as well. In type 2 diabetes, symptoms may not show up, so it's important to test blood sugar to see if you're at risk. Type 2 diabetes is preventable with healthy diet and exercise. It typically takes 9 to 12 years for a person to identify diabetes or prediabetes. So it takes a long time to get diagnosed. All the while, there might be problems occurring in your body. So it's important to find out early what the risk factors are. Some of those risk factors include having prediabetes or being overweight, being 45 years or older, having a close relative like a parent or a sister, having had gestational diabetes during pregnancy, or giving birth to a baby that's over 9 pounds, and having non-alcoholic fatty liver disease. Gestational diabetes is diabetes while pregnant. It usually goes away after pregnancy. It increases your risk for developing type 2 diabetes later in life. And those children that are born are also at an increased risk for diabetes in their adulthood and obesity. This type of diabetes may be preventable before pregnancy with a healthy diet and regular exercise. For prediabetes, we see that 88 million Americans, adults, have it. That's more than 1 in 3, making a whopping 84% that they don't even know that they have it yet. Blood sugar levels are higher than normal, but are not high enough to be classified as type 2 diabetes. This type of diabetes puts the individual at an increased risk for diabetes type 2, heart disease, and stroke. Sometimes we may not see symptoms of diabetes, but there are some. So these are a few that you should keep in mind: increased thirst, frequent urination or extreme hunger, unexplained weight loss, fatigue and irritability, blurred vision, dizziness or feeling unsteady, having sores that are slow to heal, or being prone to having frequent infections like in your gums or skin, and tingling or numbness sensation in your hands or feet could all be indicators.
All right, thank you, Maria. I will take over. I'm just switching my pin for the video for the recording. Okay, so diabetes can affect really our whole body. It affects our cardiovascular system, the blood vessels, the nervous system, especially the nerves in our hands and feet, our vision, our teeth and gum health, our oral health, the kidneys, and the ears. And it can affect both the auditory and the vestibular system, or the hearing and the balance portion. And so there are a lot of specialists that should be involved in a person with diabetes care. And you can see that list in front of you, with your primary care physician or your internist or your geriatric physician being the primary contact point for someone who has diabetes. So thinking about hearing loss and diabetes, there are a lot of people in America that have both diabetes and hearing loss. And there's about 34 million people living with diabetes, and there's almost 35 million people living with hearing loss. And we found that studies show hearing loss is twice as common in people who have diabetes compared to people who do not have diabetes. So just the fact that someone has diabetes puts them at an increased risk for hearing loss. Even with pre-diabetes, the rate of hearing loss is 30% higher compared to those with normal blood sugar. So how exactly does diabetes, how could it cause hearing loss? There hasn't really been a causal factor determined yet, but researchers are working on determining just that. And in a 2008 study, they analyzed data from the hearing tests of adults, and they concluded that diabetes may contribute to hearing loss by damaging the nerves and blood vessels. So what causes the hearing loss, physiologically speaking, isn't entirely clear, but we know that diabetes causes damage to blood vessels throughout the body. And so this may include the ears. And that management of diabetes is crucial. So when your blood sugar levels aren't well controlled, they found that your risk of developing hearing loss increases. So there are the cranial nerve 8 is our auditory nerve, and that's what goes directly to our inner ear for both the balance and the hearing portion of the inner ear. And there's lots of tiny blood vessels, capillaries, that feed blood and oxygen to our inner ear structures. So what's happening to these blood vessels to cause them to not function as well? What damage is actually happening? This is called diabetic microangiopathy. And microangiopathy is a disease of the capillaries in which they become thick and weak. Eventually they can rupture from the weakness, they can bleed, and it slows blood flow to an area if they rupture. This is caused by diabetes mellitus, diabetes type 2. And it happens because there's excess blood sugar in the blood. Because the insulin is either not being made or it can't be used, the fat cells can't take this excess sugar from the blood. So then the endothelial cells lining the small blood vessels take the glucose from the blood. And this results in the formation of higher and more glycoproteins than normal, and thus a thickened basement membrane within the blood vessel wall. And so just like the picture shows, it starts to get thick, and this overall weakens it and can block blood flow. And we all are mostly aware that people with diabetes can get vision loss. And I think thinking about the diabetic eye, as some people call it, it really helps illustrate this idea of the microangiopathy. So if we look at a healthy eye, we see all these blood cells or blood vessels flowing into the eye properly, into the retina. And then we see a diabetic's eye with lots of little hemorrhages and abnormal blood vessels, aneurysms, that ends up leading to blurry vision. Similarly, in diabetic peripheral neuropathy, this is a loss of feeling in the limbs, usually in the feet, but also in the hands. So there's these blood vessels coming down, and they branch into tiny capillaries, and they form along the nerves as well. Well, eventually these diseased blood vessels shrink, they rupture, and as those nerves, or excuse me, as the blood vessels disappear, the nerve can start to become damaged as well. And so that leads to reduced blood flow to our limbs and damaged nerves. So a lot of people with diabetes will complain that they've got this tingling. Sometimes it can feel like a burning sensation. And sometimes the damage is so severe that they end up needing to amputate their limbs. With hearing loss, there's not a great way to just look in the ear and see damage like we can look into an eye or like we can look into the foot with imaging, because the inner ear is a solid structure of bone and it's filled with fluid inside it. So it's really difficult to look inside until after someone's passed away and we're looking at a cadaver. So a lot of the temporal bone studies we see are on cadavers. And in 2006, Fukushima and colleagues did a study where they looked at about 18 people. So not very many people for this study, but they looked at 18 people who had diabetes type 2, and then they matched them to 26 people who did not have diabetes and looked at the inner ears. What they found was the people with diabetes had thickening of the blood vessel walls and the vessel walls of the stria vascularis, which is a really important structure inside the cochlea, inside the inner ear that we need to hear. They also found atrophy or shrinkage of the stria vascularis, loss of outer hair cells in the basal turns of the cochlea. And so there are different turns of the inner ear of the cochlea that's responsible for hearing. And the basal turns are the lower portions, and the basal turns correspond to high frequency hearing. So if we lose hair cells in the basal turns, we get high frequency hearing loss. They also found degeneration of the auditory nerve. So what might a hearing loss look like for someone who has diabetes, who comes into the clinic and is having trouble hearing? Well, it can really present in a variety of ways. We tend to see low frequency hearing loss if there's microvascular disease or cardiovascular disease and diabetes. And that's likely due to issues, again, with the stria vascularis, and it ends up usually in the apex of the cochlea, which corresponds to low frequency hearing, or low frequency hearing loss, rather. But diabetes can also result in mid to high frequency hearing loss. We see loss of outer hair cells in the basal turns. That would be high frequency hearing loss. People with diabetes are also prone to taking medications. They may be taking painkillers for pain in their limbs from the neuropathy, or they may be having trouble fighting infections. So they take really strong antibiotics that are ototoxic to help remedy their infection. And ototoxic medications, if you haven't watched my talk on it yet on YouTube, please watch that. But the ototoxic medications cause high frequency hearing loss in some cases. So we can see a variety of different types and configurations of hearing loss resulting from diabetes. So far, we've really just talked about diabetes and hearing, but diabetes also has a big impact on our balance system. And this is for a few different reasons. Our balance system is really multifactorial, and we need to be able to see where we're going and see where we're walking to stay upright. We need to be able to feel the floor below us and know if it's sturdy. And we need to be able to sense where we're at in space and sense motion. And that sensation comes from the vestibular system of the inner ears. And diabetes puts us at an increased risk for a fall because of the vision loss that happens, the loss of the feeling in the feet, and potential damage to the balance or vestibular system of the inner ears. And that can all lead to even more reduced physical activity, which can worsen the diabetes if you're scared of a fall or if you get injured from a fall. Serious injury could also lead to resulting infection. That could be hard to fight with diabetes. And that could all lead to reduced mobility or the need for assistance, which can have a really big impact on quality of life. So if you have diabetes, what should you do? Well, thinking about hearing, which is what I specialize in, you should get a baseline hearing test, even if you don't notice any hearing difficulty yet, because sometimes people don't always know what they're missing. Hearing loss can be invisible, and it's difficult to know if you're starting to miss some high frequency sounds until it gets really bad. So ask your primary care physician or your internist for a referral for a hearing test. Certainly eat a low sugar diet and exercise regularly to try to reverse the diabetes if you can. And ask for a referral to a diabetes educator. The more you're informed and the more you're educated about diabetes and how you can live a healthier lifestyle, the better off you'll be. And to know what other specialists you need to see to help manage your care. So to summarize what we've talked about today, diabetes really affects the whole body. And whether or not there's a causal relationship between diabetes and the ears is still being investigated, but we do know that people with diabetes are twice as likely to have hearing loss than those without. So getting hearing checked should be standard procedure when a diagnosis of diabetes is made. Diabetes type 2 can be prevented with a healthy diet and regular exercise. Become educated on diabetes. Diabetes.org is a really great place to start for information. And if you think you may be at risk, talk to your doctor about getting your blood sugar checked. So these are some resources for more information, both national and local to North Carolina. And at this point, we will stop our recording and take questions. If you're watching on YouTube, thank you for joining us, and please check out our channel and see more of our videos.